Hi, everyone, and welcome to a new episode of our podcast series about IoT and embedded technologies. Today, we're going to talk about connected health, which is a very topical subject today. And our special guest today is Samir Bounab, our Chief Revenue Officer at Witekio. Hi, Samir, how are you?
Hi, John. I'm good.
Samir, could you give me a quick definition about the connected health?
Yeah. So I think, people have some confusion between what is a high-end medical device, such as an X-ray, such as ultrasound devices, and which is actually some Witekio customers work on these kind of devices. Mm-hmm. Well, for me, connected health is something a bit different. Even if these devices are connected, for me, connected health is the fact of connecting some devices that were not and that are there to collect data from a patient. That can be to collect heart rate, temperature, blood pressure, blood indicators. Mm-hmm. So for me, connected health is about that. It's about a new way to collect data on a short time range or a long time range.
Okay. So is this data supposed to serve in a preventive and predictive way of doing health prevention?
So we are asked a lot of times about medical stakes, I would say. At Witekio, we try to be humble on that field. We are providing new tools for the medical industry and as well for the doctors and all the medical professionals. And as every new tools, you can use that for the good or for the bad. You can use that for prevention or for prediction. You can use that in an existing methodology or create new methodologies. At Witekio, we just enable somehow, which is already a great mission, but we just enable devices to be well connected, to be well secured, to be scalable, to be long lasting. Mm-hmm. And therefore, we provide that to the industry. Now, about more specifically your question, obviously the fact of being able to collect a huge amount of data on many different patients, if they are open to, obviously, that will allow a lot of changes in the way we do healthcare, in the way we treat patients. What I can foresee definitely is a doctor right now without connected health will see you once and be able to make a diagnosis based on protocols he has. So he will check some different indicator you have on your body, what you tell him, what he can feel on your body, and based on that he will do a diagnosis. But it will be on the 5 minutes, 10 minutes, 15-minute time frame. That gives information. What we see with connected health, we could be able to collect data for a year, for 2 years, for months, to compare your heart rate compared to what it was 5 years ago. And so that will give to the doctors the power of having almost a clinical study about each patient. Plus, if you compile that with millions of patients, that gives another tool as well to compare a lot of indicators. So for me, it's like an augmented doctor that will have, if he wants to, and if he's trained to, ability to have a much more 360 diagnostic on the patient.
Okay. But regarding all this data that you're talking about, obviously doctors nowadays have huge amounts of patients. Mm-hmm. They have several patients every day. So if he has data on each patient every day, every hour, like is it going to be a lot amounts of work for him, or is it going to be all centralized in a computer or something like this? Or do we need new fields of work, such as new, data analysts or new jobs like this to serve them and help the health system?
So I think we have two ways to see that. First, there is already a lot of fragmentation into all the doctor jobs. You can have a radiologist, you can have a generalist, and the radiologist is already pre-processing data for the generalist and somehow giving some guidance, some data about the body state, about the patient state. So we could imagine exactly the same thing. While a radiologist is looking at a picture or at the X-ray, why not having a data doctor that will look at 1 year, 2 years of data, or 6 months, or 6 weeks, or whatever he has, to make a first analysis, which is not a diagnostic, but just a factual statement that he can share to a generalist that will use that after a while to have another data point for the diagnostic. That is one way of seeing things. Another way would be to say, okay, no, it's up to the doctor to change the way he works. And for that, we would need to change somehow the way we see medicine. Right now, we go, especially if we speak about preventive medicine, a doctor right now, you see him and he's paid only if you're sick somehow. What if, in that case, he would be paid if you're not sick? And therefore, he has to proactively look at your data, and you pay some kind of as a service. So he can review on a regular basis every month, every 2 months, every 3 months, every year your data and anticipate some problems you might have, some behavior you need to change. So definitely these are two ways of seeing things. Back to your particular question, definitely based on the time they have and the model as it is right now, I wouldn't expect them to be able to take the best of what the new technology is offering right now. And maybe this is why they fear seeing that new stuff. They still have 10 minutes or 15 minutes. It might be different from a country to another, but it's still a short period of time to make a really accurate diagnosis. They have a personal responsibility on what they say. So they have a lot of pressure. And I can understand that they can not really use right now what is that new tool.
Okay. And regarding the patients, with what everything is going on right now with the data, I'm talking about big companies exploiting the data, making money of it, targeting people intrusively. Do you think people will be up for sharing the data with the doctors?
I think, well, it will. Let's divide the topic in two things. One thing is, will people misuse the data or use the data for business purposes that are not the initial purpose that we would like to? And definitely we need laws, we need rules about that. I would not like my health data to be treated as my Facebook account right now. That would be pretty scary. So definitely we need to make sure that there is a model we all agree with people doing sociology, philosophy, legal, ethic. We agree on how to treat the data. Second thing is about hacking. Even if we put the right rules to avoid that legally you can access data and misuse them for business purpose, what if a hacker can take the data and access to really, really confidential information? And critical, obviously. And that can be a personal hacker, that can be government hacking, that can be pretty scary. I would say here, that will happen. I mean, there is no risk zero. There is a risk. If you don't want your data to be misused, you don't share your data somehow. So it will be a question of risk benefits. As we do for Facebook. I mean, we like to use Facebook, so we sign, I can do whatever I want with your data in every country in the world, and you cannot say a thing, tick the box, we tick the box. So it's an extreme example, but for medical and health purpose, if people see a value in sharing their data, being, okay, I will have a better treatment, I'll have, a cheaper insurance, I'll have a cheaper healthcare, they will share their data and they will take the risk. There is no zero risk, for sure. So I would say it will happen. We need to have the legal framework to make sure it's not a complete mess and it's not too dystopic. And we need to make sure that there is a real benefit for the people that are sharing their data.
Yeah, because I'm going to talk about my experience with sharing my data. In France, we have this application called Amélie, and it's really convenient because by sharing my data, I can order a new card that will allow me to buy free medicines, and I can follow my consultations with my doctors and find other doctors. So it's really convenient. And I agree with you. I mean, there is no reasons why people wouldn't share their data, even if we will still have really reluctant people about rising technology on the health system.
Mm-hmm.
What I'm going to talk about now is another side of connected health, and I want to talk about the actors, whether they are from the administration, whether they are the insurance or the hospitals. How would you see the paradigm, the system of it?
So I think, as you said initially, there is an opportunity, thanks to connected health, to move to a more preventive health. Now we could debate about what is preventive. Let's narrow that down to something which is take some data and try to extrapolate to help you to change a behavior to avoid having a disease somehow. In order to do so, we need to change the business model, which is, as I said before, what if we pay to be healthy and not just to be cured? To that end, I think the only stakeholder that can really right now have a benefit in prevention are insurance, because we all hate to pay for something that is not direct value. We all wait to have a problem before solving it. We can see that in various examples lately. So definitely, I think insurance, and for sure they are working on that, will be the one that could push for this kind of model and engage some doctors and some countries to propose this kind of model, because they will benefit economically from that. Because if they have their customers that are less, that have less disease and less problems than the others, they will do more money somehow. So definitely they can change the paradigm to allow making sustainable business model with prevention.
Right. And what about the manufacturer position? Don't you think that it will be an obstacle, or would it be hard to implement this sector and to invest in this sector within the businesses, for instance, at Witekio?
So obviously, if we take example of many European countries, a lot of the money is coming from curation. So therefore, there is not a lot of money for prevention. So again, what if insurance invests in this kind of device, as they did for automotive? I mean, for your car, now you have some devices. Actually, at Witekio, we've been working on this kind of devices that are taking into account the way you drive, velocity, the hours, where you drive, and how nervous and aggressive is your drive compared to others, etc. And based on that, I'm not saying it's good or bad. Personally, I would not like to have that, but still, they have this kind of solution, and they propose a bonus if you have a good driving.
Good health.
Okay, a good driving that will reduce statistically the risk that you have an accident. So they are working on that, and sometimes they push for OEMs to work on that, or device makers. Sometimes they develop this kind of devices themselves. I would not be surprised that they launch the same kind of devices, or that they fund companies that do that. They invest in startups doing this kind of stuff, and that money at some point will go to Witekio, because they will need good software, they will need over-the-air update, they will need a good Bluetooth connection, they will need good security, they will need good battery life. So again, definitely, I think without any big business model change, insurance will be one of the key drivers of that change.
Right. And you talked about Witekio's solutions in the connected health. What did you do as a device or a system to serve the health system?
So usually these kind of projects are really confidential, so I cannot give names, but I can share some topics. And maybe I'll answer first on what is our main focus in medical devices. As I said before, a lot of these kind of connected health devices, and not speaking about high-end devices for hospital, etc., but let's speak about data collection devices. One of the key challenges of IoT consumer, so IoT that people buy to wear, and this kind of connected health devices will be the case, is people don't use that for long. After 3 months or 6 months, they put that in the garbage or they don't use that anymore. Why? Because there is no value for them. The value in the long run, besides the gadget effect of having few data that you get, so they get bored about it. But that is a key stake we work on at Witekio with UX design, to say, okay, how to design something that is meaningful, that will be seamless. So you don't want to have a big machine on you, you don't want to be checking too much. And how can we give a feedback to the people so they have data on that? If you have your doctor that is asking you to collect some data for weeks, that is good that you can access that data as well. So that changed completely the paradigm between doctor and patient. Before it was the doctor says you need to do that. I know you do that. And here, patient will be active in the diagnosis. So a lot of our emphasis is on UX design, how to anticipate the journey in a day, in a week, in a month, to have features and software design that is meaningful. So we really start from the people, from human-centric design, rather than from the technology, even if we are technologists.
Right. You talked about people seeing our solutions as gadgets. Don't you think that there will be many obstacles regarding people seeing it as just gadgets, and also as many countries in Europe mostly are relying on a free health system and insurance in many countries in Europe. Don't you think that people will be reluctant to pay those new kind of jobs, new kind of technos, even for people to pay their doctor to check their data and regularly feedback them on their health state?
Yeah, I think you're right. Unfortunately, I think that this will be countries that have more private sector in terms of healthcare that might be moving faster, because public sector might be a bit longer to react. Depends on the country again, but it's a big system, so it's harder to change than small companies or private sector. So definitely, again, it's a question of risk benefit or pain benefits. If at some point it's a way to reduce drastically healthcare costs for a country, if it's a way to really improve patient treatment, etc., and people feel that will move forward. If you look at what happened during the COVID, the fact of being able to have remote consultation, thanks. It was existing since years. It's just a stupid Skype. It's really easy to implement. I mean, it's been 15 years we can do that. Still, it was really not mainstream because fear, because not exactly needed, and that was kind of a chicken and egg problem. People were not using that, so they were not really believing it was efficient. COVID strike, beam, everyone needs to move to that because it was. For most cases, impossible to go to the doctor. And now it will be in the habit of the people, and it will reduce maybe the cost of healthcare because this kind of consultation will take less time. Maybe it will be less costly for government or private sector. And so it will launch a dynamic.
Okay. Yeah, definitely. I think that remote consultation since COVID-19 has been a great tool, and it's really convenient for us to stay safe while still being able to see our doctor. But I want to say that doctors' jobs will be seen as godlike thing for the eternity, and it's been like this since antiquity. So technology definitely won't replace them, but it can serve them to predict and save people's life. Thank you for attending to this podcast series, and don't forget to like, share, and follow us on our social media. Stay tuned for another episode of our series about IoT and embedded systems. Bye.